The Chief Minister of Gibraltar is not lying to the people of Gibraltar. This has been a very difficult year. And what we've done is say to the people of Gibraltar, at every stage, you're going to get the truth from the government of Gibraltar, however uncomfortable. And in the context of spending in respect of the health service, as Ms. Hassan Nahon actually knows herself, there is no question of spending on the health services being cut in the next financial year. Look, the government has already handed to all members of parliament this document. These are the estimates for next year. I'm not going to call Marlene Hassan a liar, like she has called me, but I will say that when these figures are published, these figures that have been circulated to her and to all other members of the parliament already, what she has said will be demonstrated to be untrue.
Together Gibraltar claim that cuts are being made now. They may not be direct cuts, but a reduction in the number of staff by way of not renewing vacancies. That's austerity by the back door, surely.
Well, but for goodness sake, you've got to realise that we are in a situation where we've just been through a global pandemic. Recruiting for the health authority is sometimes something that has to happen internationally, not just locally. So, of course, in the health authority and in many other departments in the government and in many private enterprises in Gibraltar, in many private companies, recruitment is not what it would have been in other years. But it is absolute nonsense for Ms. Hassan Nahon to suggest that the government is not investing in our health services. We have a huge amount, larger amount of doctors, of consultants in our health services, of nurses in our health services than ever before.
So why haven't GHA services returned back to normal as yet, by your own admission in your press statement yesterday? You've been on television saying that Gibraltar welcomes tourists now and that Gibraltar's open for business. So why hasn't our GHA returned back to normal?
No. Let's be very clear, Ross. We have not got tourists back. We are planning to have tourists back, probably from the 17th of May. They're not here yet. We are going to have the health services back to normal. It would be, in my view, unfair and to lead the public up the garden path for Ms. Hassan Nahon to pretend that she could have transitioned the GHA from the pandemic response to what we might call normal operations in a tighter or easier way than we are seeking to do in order to ensure that the general public have the service that they need from the GHA as from all the other departments of government for which we are responsible.
So by way of clarity, you don't intend making any cuts at the GHA and you do intend filling those vacancies as they come up?
There's no question of us not continuing to have the numbers of people that we need to have on the front line to provide the health services that this community deserves and expects. That's what these estimates show. And in June or July, when we have the budget debate, and you can come back to the interview Ms. Hassan Nahon gave you yesterday and the interview I have given you today, I am extremely confident, because I wrote them and I published them with the Financial Secretary, that you will see that what Ms. Hassan Nahon said was my lie will be demonstrated to be her untruth.